connection with concerns here raised in a previous news item on plans to relocate the maternal and health department at the Punta Gorda Community Hospital compound, Love News was able to get in touch with Chief Executive Officer in the Ministry of Health, Dr. Peter Allen, who willingly explained more on the use of the annex building.
Well, the annex building is a building that's been designed and put on the hospital compound to support pregnant women and their families when they come to deliver babies at the hospital. So the idea is that pregnant women have to come from quite far, and sometimes they and their families have to stay more than just one night. We decided to construct with our NGO partners and faith-based partners what's really a birthing center. So it's a place where while the mother is giving birth in the hospital, family members can stay at more or less no cost to them, so that they can be with the pregnant lady during the course of the pregnancy. That building had additional space upstairs, and I understand that due to space constraints at the clinic, at some point, some months ago, a decision was made to move what used to be called the maternal and child health care section over to the upstairs of that building. We are moving towards an integration of services. So that means that if a pregnant woman or any family member comes to attend the clinic, it shouldn't just be looking at maternal and child health. It should really be looking at family and community health.
Dr. Allen also spoke of the relocation plans and efforts by the Ministry of Health in providing continued quality integrated health services and other support services offered to pregnant mothers and their families in Toledo.
I used to be the head of the planning department, and the way from a health planner's perspective that we would look at this is we would look at the floor plan of the available space in both buildings if necessary, and then look at what function is applied to each room or each physical space on the floor plan. And then we would determine how best to provide the best functions for the patient in the one space without compromising the service that we offer to them.
Although the administrator at the Punta Gorda Polyclinic had mentioned to Love News here that the relocation process will take place by the ending of this month, Dr. Peter Allen further commented on the time element and spoke of continued efforts related to the relocation plans.
We haven't set a deadline. We'd like to see it happen as quickly as possible in order to make sure that the patients get the best care as quickly as possible. But obviously the most important thing is that it is done properly. So if it needs a little more time, all they have to do is just discuss it with us. But I think Dr. Largaspada will be visiting down there anyway, just to do a little bit more training, because clearly there's maybe not a clear understanding of what the ministry means when it says that it wants integrated health services.
Dr. Allen reassured that the concerns expressed here are being addressed and commented that all efforts to implement any relocation plans for the maternal and child health department here are directly for the benefit of the expected mothers and babies who require the services of the maternal and child health department and other medical services offered by the Ministry of Health in Toledo. Reporting for Love News, Paul Mahone, Punta Gorda.